the Ministry of Health has had 6 months to be able to put all the things that we've been asking to put in place, and it still has not done so. One of the most important things is that we have the private doctors and private clinics to this day do not know how they can participate or how they can help. They understand that the Carl Hospital or the regional hospitals can be overrun within a day because they are limited facilities or ventilators and so forth. And they have been offering to want to participate. When I was a member of the National Oversight Committee, I brought it up several times, and they said that yes, they're going to do it, and it hasn't gotten done. We have a crisis in San Pedro. As we speak, I have spoken with the people, the health workers, the frontline workers in San Pedro, and they're crying out for help. Do you realize that the tests that were done on Friday, they're not being brought to Belize until today, simply because they have no money to pay for the fuel, not even to hire a boat, but to pay for fuel to be able to bring that. Do you realize that the care center that was set up by the citizens of San Pedro, that they don't have a budget for to pay for electricity and pay for water, that the water has been cut in at least two times? I mean, they have no quarantine facilities in San Pedro right now. The numbers are raging in San Pedro, and they cannot take them to the polyclinic. And they have been asking the department here, the Ministry of Health, that they need to find a place where they could quarantine people with the virus in San Pedro. Housing in San Pedro is a huge problem, where a lot of people live in some small quarters and they cannot self-quarantine in their homes. So these are some of the issues that needs to be addressed head-on, and I believe that the government has lost 6 months to put these things in place.